Welcome to the Anxious Child Podcast, the podcast that helps you best work with anxious kids and teens. Now, here's your host, Stephen Quinlan.
Hey everybody, today on the show we have Richard Capriola. Richard was an addiction counselor for 11 years at the Menninger Clinic in Houston, Texas, which is one of the top 10 psychiatric hospitals in the United States. Before he retired in 2019, Richard has also written a book called The Addicted Child, which provides guidance to parents who are trying to navigate their way through helping their adolescent with substance use disorder. I thought it would be great to have Richard on the show, given all the overlap that there is between anxiety and attempts to manage anxiety, often through substance use. Richard has a ton of experience and is able to synthesize what can often be overwhelming and certainly emotional information into concrete advice that is more easily digestible for both professionals and lay people alike. I'm hopeful that this will be helpful to someone out there who is trying their best to help their child who is suffering from a substance use disorder. So let's get right to it. No advertisements today. Here is the interview with me and Richard Capriola. Welcome to the show. Thanks so much for being here.
Well, thank you, Stephen. I really appreciate you taking the time to talk to me and talk about this issue of adolescent substance abuse. So I really appreciate your willingness to help me reach out to others about this topic.
Yeah, absolutely. And I mean, that's so much of what I feel like this podcast is about, is just providing people with as much information as possible around various mental health subjects, obviously anxiety in particular. But so yeah, I'm thrilled that you're here. I'm happy to talk about this with you for sure. I wanted to before we get going a little too much, I wanted to dive into your backstory. I think you have a really interesting, I was doing a little bit of research earlier, and I think you have a really interesting background in that you didn't graduate from high school and
No,
yet ended up with these two successful careers. Tell me a little bit about that.
you're right. I was not too happy as a high school student. Really didn't enjoy high school very much, so I dropped out about after the middle of my junior year.
Mm.
And I was working, continued to work, and went over to the community college system and applied to go to the community college. And the counselor tried to encourage me to go back to high school, but I told him I wasn't going to do that. So he let me in on probation for a semester, and after the semester, I showed him my grades, and he told me to keep going.
Mm.
So I finished up there. I transferred to Western Illinois University, got my master's degree there, and then went on to earn an MBA at the University of Illinois and a master's degree in human services with an emphasis in addictions counseling. So no high school diploma, but 3 college degrees.
Boy, you don't hear that every day.
No, you don't. I just happened to be very blessed to be able to get in at that time. I'm not sure people could do that right now.
Yeah.
But I was just one of those kids who didn't like high school but loved college.
Oh, yeah. I've said to a few teenagers that I've been working with before that things are so much different when you get to college, that if
Yeah,
you can just sort of stick it out, that you'll be taking courses that you're actually interested in. And sometimes that can make a really big difference as opposed to
that's
these things that you just sort of have to learn.
yeah, that's good advice. I've told a number of when they tell me how much they hate high school and they don't like it, I tell them, well, give college a try. You might find it a completely different environment. I know I did,
Yeah.
and it's just completely different. So if
Mm.
you don't like high school, stick it out, get through it, and then try college and see if that's a better environment for you.
Yeah. And so you then you started out in a much different career for where you
Yeah,
eventually ended up doing the substance abuse counseling that you started doing. Tell me about that, just briefly, what you were doing prior to the substance abuse
Well,
work.
during my senior year at Western Illinois University, my undergraduate program, I applied for a legislative internship with the Illinois General Assembly, and I was awarded an internship. So I spent a year after graduating as an intern with the Illinois State Senate.
Mm.
And then shortly after that internship ended, I went to work for the State Board of Education, and I worked for the State Board of Education for about 32 years as
Wow.
at the State Department of Education as a lobbyist and in charge of communications and those and external relations and working with the superintendent. As I transitioned out of that career after about 31 years, I started to move over and into mental health and accepted a position. At the same time I was working for the State Board of Education, I was working part-time for a mental health center, a
Mm.
regional mental health center, working in their crisis center.
Hmm.
And we would have people from the hospital come into the crisis center, and we would take care of them for a period of time. And I noticed that they had not only a mental health issue, but also a substance abuse issue.
Mm.
So I went back to the University of Illinois and obtained a master's degree in human services with a concentration in addictions.
Mm.
I continued to work at the crisis center for a while until I was offered a position at Menninger Clinic in Houston, Texas. Menninger Clinic is a large psychiatric hospital that serves adolescents and adults. And I was hired by Menninger Clinic to be an addictions counselor for both adolescents and adults who have mental health and addictions issue. I was hired to be an addictions counselor. I worked for Menninger for about 11 years in Houston and retired a little over a year ago. And that's when I set about writing this book.
Mm. I see. So tell me about that shift where you went from being in this legislative place to working with the substance use. Was how did you, I mean, obviously, as you said, you noticed being in the mental health field that there
Yeah,
was this crossover. A lot of times the term you'll hear is comorbid
yeah.
issues. So you have on the one hand a mental health diagnosis and on the other a substance use disorder. What for you made you make that shift and go into working specifically with the substance use disorder?
I think it was in working in a mental health crisis center, seeing the struggle that so many people were going through, not only with their mental health issues, but also their addictions issues,
Mm.
and the number of people who had both, who
Mm.
had a co-occurring disorder.
Mhm.
That really sparked my interest. And I made the decision that I wanted to go back and learn more about addictions. So I went back to the University of Illinois, and that's where I got more training in addictions.
Mm.
And and that led to wanting to move over into the field and do it on a full-time basis rather than a part-time basis. And that's where the job with Menninger Clinic came in to play when I was offered a job at Menninger, which is a great psychiatric hospital. I met a lot of outstanding psychiatrists and social workers and psychologists there that were very impressive, and I was honored to be able to work with them. And I met patients, adolescents, and adults from around the world
Mm.
who were coming to Menninger for treatment.
Mm. Interesting. So, speaking about these co occurring disorders, I'm wondering your thoughts specifically on anxiety and what role you feel like that plays in substance use disorder.
Yeah, because that is such an important issue. A lot of teenagers that I worked with, and adults, but a lot of teenagers that I worked with who were smoking marijuana,
Mhm.
and these were very bright young men and women whose IQs were above average to superior. They were smoking marijuana multiple times a day. And when I asked them to help me understand why they were smoking marijuana, why were they smoking marijuana? The number one answer that came back was, it helps me with my anxiety.
Mm.
It calms me down. It helps me deal with this overbearing anxiety that I have. So Anxiety is a very important issue, especially among adolescents, because they're seeking, like adults, when we have an intolerable feeling like anxiety or depression or whatever is uncomfortable, we're going to seek relief. We
Mhm.
don't like sitting with these uncomfortable thoughts and feelings and memories, so we
Mhm.
seek relief. And for a lot of people and a lot of adolescents, that relief comes from a drug like marijuana.
Mhm.
Um, and these kids were using a lot of marijuana to help manage their anxiety. What they didn't realize was the effect it was having on their brain, because the adolescent brain is different than the adult brain. The adolescent brain is in the process of developing. So when I see the psychological tests come back on these kids, I could see very easily the impact that marijuana was having on their brain. Um, uh, and another thing they didn't understand was that in many cases, although the marijuana would help with the anxiety in the moment, it
Mhm.
has a rebound effect. And in many cases, it makes the anxiety worse over time. And then they end up smoking more and more of the drug to get the relief. But there's no question that anxiety is a big issue for which a lot of kids are using marijuana. And I would imagine a lot of adults too.
Yeah, it's funny because as far as a because I hear a lot of the same thing, especially with teenagers. And I think these days, as marijuana in particular gets more mainstream acceptance and is becoming legal in various states across the nation, there's almost a sense of it has a wellness kind of component to it. Like if you see there's sort of these, I see bulletin boards in some areas that, will advertise whatever sort of, it's usually green something or other, right? The place that's distributing or medical use, and certainly not to discourage people who have medical conditions in which marijuana can be very helpful and effective. But as far as when you're talking about something like using it to manage your anxiety, if you are in a situation where you start to have something like a panic attack, being high is probably the last thing you want to add to that.
Yeah, yeah.
So there's it's such an interesting choice to make that as something that's going to help you manage it, when really it can completely backfire on you.
And it can rebound on you and make your anxiety worse.
Hmm.
If you're an adult and you have a history of any type of thought disorder, schizophrenia, paranoia, smoking marijuana is like playing Russian roulette with your brain. It has a tendency of backfiring and pushing you into another psychotic event.
Hmm.
Now, that's not the case with everybody. I would advise anybody who has any history of a psychosis or schizophrenia or a thought disorder to stay away from marijuana, because it has the potential to cause you to relapse back into that type of a mental state.
Hmm.
For a lot of people who smoke marijuana, adults, there's no problem. They don't have any big issues with it, and they claim it helps. My concern with marijuana is the adolescent population and the developing brain. That's different than adults. Adults want to make decisions to smoke marijuana if it's legal in their state, fine. But adolescents, you got to protect that developing brain. And I've seen too many cases where there are effects on things like short-term memory and processing speed of the brain and motivation. So for adolescents, I advocate, you have to do everything you can to protect that developing brain. It's very vulnerable.
Mm. Yeah, and in the book, you talk about giving adolescents facts around their developing brain
Yeah.
and around substance use and how that affects it, rather than, I think there's sometimes a tendency to be almost sort of preachy about these things,
Yeah.
which if, an adolescent, their BS meter is like very highly attuned. So
Yeah.
if they have any sense of that, they're going to tune you out completely.
Yeah.
But one thing I think in my experience, and I think you're echoing this in the book, they do respond to is, here's information.
Yeah.
and you do with it what you will. So I really liked that approach that you outlined.
It's the one thing that I found in the years of working with adolescents that captured their attention. They weren't interested in hearing about how the drug's illegal and all this other stuff. But what did capture their attention was the neuroscience, when I could talk to them about how their brain works and what different areas of the brain they're responsible for. And then I could show them a picture that of where marijuana attaches itself to in the brain. Then they could see, how this might be affecting their brain. And they were really interested in the education part of it, the neuroscience, the learning part. That really was what I used to capture their attention.
Yeah, it makes a lot of sense. Is it different when you are working with adolescents and other drugs, alcohol, or is your approach basically the same? Or because there's, as far as the stigma around, I mean, there's still, I think, a little bit of a stigma around marijuana, although that's changing significantly. The acceptance of something like alcohol is so much different that I'm wondering if you have to take sort of a different tact with that.
No, when it comes to adolescents, the approach is the same.
Mhm.
I work with them first of all to get an understanding of why they're using a substance, and for different kids, it's different reasons. For many of them, it's to regulate some intolerable thought or feeling or memory. Maybe it's to medicate anxiety or depression, or maybe it's because they've had some trauma in their life, perhaps
Mm.
been bullied.
Mhm.
So I try to get at the core reason. And then it's a question of educating once I understand why they're doing it, and developing that relationship, and trying to move them from the pre-contemplation stage or the denial stage into at least into the contemplation stage, where they're at least willing to look at it. And for an adolescent, moving from the denial stage into the contemplation stage, where they're not sure they want to quit. Maybe they do, maybe they don't, but they're willing to look at the pros and cons. That's a huge move for an adolescent.
Mhm.
So almost all of the teenagers that I worked with came into working with me in the pre-contemplation stage. They were denying it was a problem, and they had no intention of quitting. And through a process of working with them, I was able to move them at least to the contemplation stage, where they were open to looking at the pros and cons. Maybe they would even agree to a short-term abstinence period, because if
Mm.
I could get them to do that, I was hoping that they would see how much better they felt, how much better they were performing after maybe 3 or 6 months, and then make a decision not to return. But a lot of it was just recognizing that they come in denial, and trying to move them out of that denial stage, because until you move some out of denial, you're not going to get much traction, not much progress with them.
Mm. Yeah. It sounds like you're just really trying to plant those seeds of that there might be something here that you want to take a look at potentially, and trying to move the needle just a little bit in that direction out of that pre-contemplative phase.
Yeah, and for them to see the change themselves, not for
Mm.
me to tell them there's going to be a change,
Right.
but for them to see the change themselves. Maybe it's a subtle change, like their motivation's a little bit better. Maybe their short-term memory has improved a little bit better. These subtle changes that if they abstain from using a substance for a period of time, maybe they feel better, maybe they're performing better. And then they have to make the decision, do I want to give these gains up and return back to smoking marijuana? Or am I feeling much better that I just want to keep going? I
Mm.
think for a lot of them, hopefully the decision will be made to just keep going and stay away from it. But they
Mm.
have to see how better their life is without it than it is with it.
Mm. Talk to me about the role of parents in this situation, because I'm imagining that you very much have to either elicit their help in some way in maintaining those gains that the teenager has made and to help them to keep going, and maybe possibly, depending on who the parent is and what their relationship is like, maybe even encouraging them to let the teenager figure things out on their own a little bit.
Parents play a crucial role in terms of, number one, recognizing that there's a problem. I've sat across from many parents and I've gone through their child's history of using a substance and I've given them the diagnosis. And they would look at me and they would say, I had no idea this was going on. Or if they did suspect their child was using a substance, they would say, I sort of thought something was going on, but I didn't know it was this bad. And then they start to feel guilty as parents. How did
Mm.
I miss the warning signs? What did I do wrong? Am I a bad parent? They missed the warning signs because nobody ever told them what the warning signs were to look for. And that's why it's so important in my book that I list these warning signs for marijuana, for alcohol, for a child that might be developing an eating disorder or self-harming themselves, because those often can, not always, but can accompany a child using a substance. So parents need to know what the warning signs are and what to look for. Um, and I think they play a critical role in first recognizing the problem, getting the assessments done, which the child's probably going to resist, but parents have to insist that they get these assessments done that I list in my book. And then getting the child into treatment and supporting the child in treatment. And then once the child is in recovery, playing a critical role to help that child maintain the sobriety. Parents play a critical role in each one of those stages, recognizing the problem, getting the assessments, finding the appropriate treatment, and supporting the child through treatment and after treatment. And the other thing that I would say is we often put a lot of emphasis on the child, but the parents and the family need help too,
Mhm.
because they're going through a crisis of their own. So it's very important that parents build a support system for themselves. Maybe it's a family member, maybe it's a close friend, maybe it's a counselor, but parents need to get the support for themselves as they're going through this process, because it's not just the child that's affected by substance abuse. The entire family system is affected by it.
That's a great point. What are some of the signs that parents can look for specifically, and also how do they figure out whether these signs are something that are worthy of attention, I suppose, versus I'm just imagining you're the parent of an adolescent and so many things are often attributed to that's just quote unquote normal teenage behavior, which in itself is, somewhat interesting and can present as a variety of mental health issues
Yeah.
but on any given day. So I'm curious, what are some of those things and how to square that with what's in that adolescent realm of
Yeah.
behavior in general?
Well, how you sort out what is normal adolescent acting out behavior and what is a more serious situation is best left to the professionals
Mm,
who can do the assessments, who can give you a diagnosis, and who can either rule in or rule out whether or not there's an underlying issue that might be driving your child's behavior, or if it is just normal adolescent behavior. That's the role of the professional assessments that can be done. In terms of warning signs, I think the best thing parents can do is learn the warning signs. And I have warning signs in my book for alcohol use. I have warning signs for marijuana use. I have warning signs for a child that might be developing an eating disorder or self-harming themselves, because they can sometimes accompany a child using substances. As a general rule, though, I recommend to parents that they pay attention to the changes they see in their child. Parents know their child better than anyone else. So pay attention to the changes you see. Don't assume that they're just normal acting out teenage behavior. They may very well be, but they also may be an indicator that there's something else going on. And the more of these changes that you see, say, as opposed to maybe just one or two that last for a very brief period of time, but now you're seeing two and then three and then four changes, and they're not only are you seeing more changes, but they're lasting over a longer period of time, then I think you need to be concerned.
Mhm.
Some examples of what I'm talking about are a child who may have been earning very good grades and now the grades are starting to decline. A child that might have been very social and outgoing now becomes very reserved and quiet. A child who used to enjoy participating in sports no longer likes to participate in sports and withdraws. A child who very openly introduced you to their friends. You knew who their friends were. You might have even known who the family members were of their friends. Now becomes very secretive of who their friends are. So these are examples of some changes that you see in a child. Sometimes they're just normal adolescent acting out behavior. They'll go through a phase, they'll come and they'll go, and hopefully they don't last very long. But what you want to pay attention to is the extent of the changes. How many of them are you seeing? And the duration of these changes. How long are they lasting? And the more of these changes you see and the longer they're lasting, then the more concerned you should be as a parent and move to the next step, which is to get the assessments done so that you can find out what's really going on with your child.
Okay, so if people are seeing those prolonged changes
Yeah.
in different areas of that adolescent's life, and as parent, just knowing their child the best, that they have a sense of that there's something going on, because I think there's something to that too, right? I think there's sort of an ineffable quality that you just know that something might be a little bit off.
Yeah. Yeah.
To listen to that, and at that point, then it's time to seek help from a professional and have some of those assessments done that you're mentioning. Do you have any thoughts around kids who are resistant to getting these assessments done? And I'm trying to picture sort of going through this process and somebody being sort of dragged in to do these assessments. And is that do you have any advice for somebody who might be up against something like that? I imagine there's not a whole lot of super willing adolescents who might be experimenting with substances who are happy to skip into the clinic.
It's just about every teenager that I worked with who was coming into Menninger Clinic did not want to be there, fought their parents tooth and nail,
Mhm.
acted out, got angry, and just hated the idea of being there. They did everything from negotiate to beg to threaten to not come into the hospital. But the parents recognized that this is a serious situation. It had gotten out of hand, and they needed to get their child into getting an assessment and treatment. So it's hard as a parent to do that, but parents have to hold the line. They have to insist that the child get the assessment. If you're concerned that your child is abusing a substance to the point where you're concerned, or perhaps the behavior is out of control, or you suspect there might be an underlying emotional issue, you need to hold the line. Recognize that the child's going to fight you. They're not going to want to do the assessment, but you need to insist that it be done. And not every child needs to go to a hospital or to a clinic to get the assessment. You know, assessments can be done by professionals in private practice, by social workers, by psychologists, by physicians. So it's not that you need to admit your child to a hospital to get an assessment done. You can get assessments done in a variety of different settings. And the important thing to do is get that assessment done, because that's going to give you the information and the diagnosis as a parent. And if there is an issue, you're going to know what it is, and you're going to be able to formulate a treatment plan on how to address it. And that treatment plan is very individual to the child's issues. Some children will do very well in an outpatient treatment program where they might see somebody maybe once or twice a week. Some children might do better in an intensive outpatient program where they go several times a week. And then some children, because the underlying issue is so severe or the substance use is so severe, they may require what we refer to as residential treatment, where they will be in a treatment program for a series of months. But there is no one treatment that fits every child. It very much is a process of doing the assessments, getting the diagnoses, and then putting together a treatment plan that's specific for that child.
So going into that situation, then knowing, as you were saying, that it doesn't mean that you're going to be going to a really strict locked down facility, because I imagine the adolescents probably have some fear around that happening
Yeah,
as well.
sure.
And also just knowing that you're going to be up against some resistance that is probably going to be pretty significant, and that there are going to be many attempts made by the adolescent to get out of that in whatever way that they can. It's just like a trapped animal or something like that. It's like what I'm picturing. Um, that's helpful going into it to know that's kind of what's happening.
And most parents have already dealt with situations where they've told their child something's got to be done, and the kid says no.
Right.
You know,
Yes.
so this is not going to be unfamiliar territory with the family. They may fight a little bit harder. They may become a little bit more hard-willed on it and strong-willed. But most parents have come up against a situation where they've told their child something needs to be done, and the kid has said no, I don't want to do it.
Yeah.
So this is another situation where the parent needs to be strong and insist that it be done.
Right. So you've already got that experience. You
Correct.
mentioned earlier eating disorders. I'm wondering if we could touch on that a little bit and how that relates to anxiety, control, that kind of thing.
Well, again, I think many times when we see a child who developing an eating disorder, there usually is an underlying emotional issue that's driving a child uh, to 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 develop an eating disorder. It might be, anxiety, depression, some type of trauma that they've experienced, maybe bullying, very poor self-image when they look at themselves. A lot of that can come from peer pressure as well. Many times when we dig underneath the surface of the eating disorder, we really can find out what's driving that child to basically have this eating disorder. And many times we find, sometimes, not all the time, we find that a child who has developed an eating disorder or is self-harming themselves is also using a substance as a coping skill because they now have another coping skill that they can rely on.
So it's very similar then to the substance use in the sense that it is something that they are using as a coping skill as a result of some underlying psychological issue, mental health issue, trauma,
Yeah.
in order to help them cope.
In some cases, yes,
Mm,
absolutely. I mean, that's certainly not the case for every child.
mm,
Why a child is using a substance varies from child to child. Some of them are using it because of peer pressure, some of them peer influence, some of it just to experiment and get high.
mm,
But for another category of adolescents, they're using a substance like marijuana, for example, to medicate an underlying issue. Now, certainly that's not the case for every kid that's using a substance,
mm,
but that's why it's so important. If a child is using a substance, we have to look beyond just the substance to see if there is that underlying issue and to rule it either in or rule it out. And many times I think parents and other people focus just on the drug, and they can miss the idea that maybe there's an underlying issue that the child is using that substance to medicate. So it's very important to get these assessments done and either rule that in or rule that out as a contributing cause to why a child is using a drug
mm.
or is drinking alcohol.
Uh-huh. Do you feel like this kind of leads into this question a little bit? And we were talking earlier when we were talking about the difference between high school and college and just sort of going through these stages that adolescents do. Do you feel like there is such a thing as quote unquote normal substance use within the context of something like going off to college? Because I feel like there is this sense of that's what you do when you go off to college, particularly in regard to drinking, I think, with college, but that it's normalized within the context of our overall culture and kind of that like college culture specifically. What are your thoughts about that?
Well, I think, first of all, adolescence is a time for many kids who take risk.
Mm,
It's a time for experimentation. It's also a time when their brains are not developed enough to the capacity where they just don't have the ability to weigh pros and cons and make rational decisions. That prefrontal cortex of the brain, which regulates our ability to rationally look at pros and cons and make decisions, is the last part of the brain to get developed, and that's around age 24, 25. So in many cases, these adolescents just don't have the brain development and the capacity to be able, to look at issues as adults can look at them or have experiences. When we look at the difference between adult addiction and adolescent addiction, there are two main differences. The first is brain development, like we've discussed. The adult brain is fully developed after around age 24, 25. The adolescent brain is in the process of developing. So the first difference between adult addiction and adolescent addiction is brain development. But the second difference is in the area of consequences. Many adults who are addicted to a substance have faced catastrophic consequences sometimes. They may have lost a marriage, they may have lost a job, they may have lost a relationship, they may have been incarcerated. These are catastrophic consequences as a result of an adult being addicted to a substance. Adolescents, on the other hand, have faced very few consequences. Their big consequences, their parent grounding them or yelling at them or threatening them, but nowhere near the type of consequences that many adults who are addicted have faced in their life. So there are some really big differences between adult and adolescent addiction.
So does that then sort of allow the adolescent potentially to be in a place of using a substance experimentally and not necessarily having to face those consequences that society will put on you, so that they can kind of figure out what their relationship is going to be to that substance? Is that kind of what you're
Yeah,
saying?
the consequences, that whatever the consequences there are for adolescents, are not the kind of consequences that an adult may face as a result of using a substance, especially if they become addicted to that substance. They can face some rather severe consequences. Adolescents, on the other hand, just don't have the experience of having a lot of catastrophic experiences. So when they're experimenting with the drug, their concept of consequence is, well, if I get caught, maybe I'll get grounded for a while, but that's about it.
Right. It makes me think too of another question I have, which is, and I don't know that there's an answer to this question because I don't know that we really know for sure what it is, but I'm curious your opinion. How it is that some people, adolescents, or whenever they start using some kind of a substance, become addicted to it and other people don't. There are those, tying into that the question I had prior to this, there are adolescents who will go through college and maybe drink really heavily or smoke lots of weed or whatever it is, come out the other side of it and be like, okay, it's time for me to kind of put that to the side now.
Yeah,
And,
yeah.
I'm going to get a job, and on I go. And then there are others who can't do that. Where do you think that comes from? Are we into sort of genetics now and how that might play a role? Or what do you think about that?
Well, there's a difference between what we used to diagnose as abuse versus dependency.
Mhm.
We don't do that anymore. We call it a substance use disorder that's
Mhm.
either mild, moderate, or severe. But there's a difference between somebody who abuses a substance for a while and then hopefully moves away from it as they get older, and a person who uses a substance and becomes dependent on it.
Mhm.
And one of the hallmarks of dependency is you start to see the frequency and the quantity of use go up as their tolerance increases. They need more of the substance to get the feeling that they're looking for. When it comes to addiction, a person who really has a severe substance use disorder, has lost control over the substance and faced negative consequences. Um, the vulnerability to a person becoming really addicted to a substance is a combination between genetics and environmental conditions. Genetics is probably responsible for 40 to 60% of a person's vulnerability to become addicted.
Mhm.
That's no different than any other medical disease. If you have hypertension in your family, you're at risk. If a woman has breast cancer in her family, what's that mean? It means she's at risk. Doesn't mean that a person's going to get the disease. It just means that because it's in their family line, their genetics, they're more vulnerable. The same is true of addiction. If there's an addiction component in the family, you're more susceptible to it. So a large part is genetics, but the remaining part is environmental factors, and that can be anything from your family environment, the relationships that you develop, the type of family support or lack of support that you have, the social environment that you're running around in. But I tell parents, all kids are vulnerable to becoming captured by alcohol or drugs. All kids. There are protective environments, but no child is totally protected. It doesn't matter where you live, urban, suburban,
Mhm.
major cities, small
Mhm.
cities, doesn't matter your income level, doesn't matter what church you go to. All children are vulnerable to being captured by substance abuse, and parents need to be aware of it. Not become paranoid about it. I don't want them to become paranoid about them, but I want them to be aware of the issue, to be educated on it, and to feel better prepared that if they're confronted with this issue, they'll know what to do. That was the whole purpose of me writing the book. It was to educate parents, so hopefully they feel more prepared and more confident to deal with this issue in the event that they have to.
Yeah, I was thinking that as you were talking, that it is very easy to get overwhelmed by this stuff because, first of all, there's only so much control that you have as a parent. If you're talking about 60 to 40% of your being able to control your environment and how that impacts things, obviously you're going to want to try to do your best with that, but ultimately it
Yeah.
doesn't matter, and it doesn't discriminate based on anything. It can be anyone anywhere that can develop that kind of an issue, and that's potentially very scary. One of the things I really appreciated about your book was how concretely things were laid out. Here are the steps that you, as you said, you start out with, here are the warning signs, and then here are the steps that you take. And it was divided, I thought, really nicely into these easily kind of digestible chapters. And you also have, I believe, a workbook that goes along with that. Is that right?
I do. I have a parent workbook, which is also very brief because I wanted to keep both the book and the workbook brief because I recognize that parents are busy. They don't have time to sit down and read 300 or 400 pages in a book.
Hmm.
So I kept it to around 107 pages with short, concise chapters that are packed with information that I hope parents find helpful. I wrote the parent workbook because I recognize that so many parents who are struggling with a child who's abusing substances need help too. So this workbook has exercises in it where they can process how they're feeling about a child that has using substances, how it's affecting them, how it's affecting their family. It talks about assessing their own child's motivation, whether they feel their child is motivated or not. It has an exercise on how to handle a brief exercise on how to deal with some anxiety that you may be feeling. And it has some tips on communication, which I think are important because we all can do better at learning to communicate. And as parents, we can do better at learning how to communicate with our child. We're pretty good when we're communicating with each other and when we're communicating with children in listening to the words that we're hearing. But sometimes we're not so good at listening to the feelings that are behind those words. And that's a skill that every parent can practice and learn so that when you're talking to your child, you're not just hearing their words, you're hearing the feelings behind those words, and you can reflect those feelings back to your child to make sure that you're getting them right. And often I'm asked, well, if I suspect my child is using a substance, what's the first thing I should do? And my answer is have a conversation with your child.
Mm.
Don't threaten them, don't accuse them, but have a conversation from the point of view of getting to understand why your child is using a substance. I'm seeing these behaviors and I'm wondering, why am I seeing them? So you want to have a conversation with your child where hopefully they will begin to help you understand maybe why they're using marijuana. Um, but this ability to listen to your child's feelings, not just their words, but their feelings, and reflect them back, is a skill that every parent can learn. And I think that when we learn it and we practice it, it can go a long way uh, to developing that good, solid relationship with our children. You can start that process regardless of whether your child is 6 or 7 or 8 or 15 or 16 or 17, and practice the skill of listening not just to words, but to feelings.
Mm. There's so much of a parallel there with, I think, the therapeutic process in general, which as a therapist, you're trained to listen to what is in between the words that are being said.
Yes,
And it can be a complex process in some ways, but at the heart of it, there's a simplicity too in just taking that, what you're receiving, that feeling, reflecting that back to the person. And as you said, seeing if that's accurate or not.
exactly.
And the other piece, I think, is that relationship, which is at the heart of the therapeutic process and also at the heart of parenting. If you don't have that open communication and based on, mutual respect, it's hard to really get very far without that.
It is. It's the foundation to developing a really good relationship, and it starts with good communication, and so that both you're hearing the words, you're hearing the feelings, you're reflecting them back, and the child gets the understanding that you really do tune into to not just what they're saying, but what they're feeling. And like I say, that's a skill that requires practice, but it's a skill that every parent can learn and every parent can practice and improve on. You
Mm.
don't have to be perfect at it. You just
Right.
have to try it.
Right. Exactly. Well, I thank you so much. I really appreciate how you have been able to take what I think is a potentially very terrifying topic for a lot of parents, and I don't want to say simplify, but sort of drill it down into something that feels more digestible and more approachable, so that if you go through these techniques that you've outlined and these steps, if they need to be taken, it just feels a lot more approachable and potentially less overwhelming. So I thank you for that service that you're trying to provide to people.
Well, thank you. I appreciate your thoughts on that, because that pretty well summarized what I was hoping to obtain when I wrote the book. Was exactly that, to help parents feel more confident, less afraid, and also to give them a sense of hope. That they can get through this, that they and their child can get through this, that there is a process that they can follow, that there are treatment options available, and there is some help in terms of identifying good treatment programs, and that their child and their family can recover from this.
All right, that was Richard Capriola. His website is helptheaddictedchild.com, and the name of the book is The Addicted Child, which is available on Amazon. A quick reminder to everyone, if you enjoyed the show, please leave us a review on iTunes. You can also support the show by checking out our sponsors, Mount Genie and BioOptimizers, and using the code Anxiety10 for 10% off at either one of those places. You can also check out the website, theanxiouschild.com, if you're interested in individual coaching with me or just to support the podcast in general. And as always, I would love, love, love to hear from you. If you are listening to the show and you have any questions or comments, you can get in touch with me via the website or on Instagram at The Anxious Child Podcast. So that's it for today. Until next time, take care and be in touch.
This podcast is not intended as medical or psychological treatment. In no way should it replace treatment from a mental health professional.